We will have a chance for a second round of questions. So if whenever you're ready, Dr. Hirji.
Okay, thanks, Courtney. Let me just double check everybody's got the slides up. Great. Okay. So, I believe some of you may have watched the briefing I gave to council on Friday. So there's certainly a lot of overlap. I think the biggest thing that I'm paying attention to right now is what we are seeing with the case trend in Ontario as a whole, where there's very clearly now an upwards trend happening. And I think that's perhaps not totally unexpected. We are getting into colder weather. We're getting into people spending more time indoors. We've had Thanksgiving. We've had Halloween festivities. The provinces, of course, lifted all of their capacity limits and many of the other restrictions. And all of that is taking away some of what has been keeping cases under control in the last little while. And I think we're starting to see the impact of that. If we take a look, across at the reproductive number, I think this just confirms that the reproductive number is well over 1 now in the province, implying that cases are going to continue to go up for the next little while, unless we do something different. We look here in Niagara, I think we can see likewise that we have had that uptick. Ours, I believe, started a little bit earlier and certainly is continuing on. We're actually now back to where we were kind of in the peak of this fourth wave back in early September. And if we take a look at, across all local public health agencies in the province, there's 34 of them. You can see that 29 out of 34 have a reproductive number over 1. So 29 out of 34 are now seeing cases go up. And if we take a look here at, what our general neighborhood looks like in terms of what the trend they are seeing is, you'll see that quite markedly, Haldimand Norfolk is seeing quite a sharp increase in cases. We're, of course, seeing an increase, but you can see more gentle increases across a lot of local public health agencies. And this data only goes up to November 4th, and it's continued to tick upwards since that time. So I think we're going to be dealing with the next little while, trying to make sure we get cases back under control, flattened out, and hopefully back down, given where we've landed. To try and take a deeper look at, what's going on, of course, this, is a measure of the mobility in society, how much people are out and about. And, through different lockdowns, you can see here, we've suppressed that mobility. When we've had the stringency index go up, basically had lockdown type measures in place. Obviously, those have been pretty flat with maybe just a little bit of opening. And we're fortunately not seeing a big change in the mobility right now. So people aren't necessarily out and about more. We may nonetheless have to try and push this down, given that people, when they are out and about, are probably in closer quarters indoors more, given the weather that there is these days, as well in closer quarters where there are no capacity limits now. But certainly I think this is a little bit reassuring that we're not seeing a big increase in mobility yet with the reopening and lifting of measures that has occurred. When we take a look at, some of the high-risk types of activities going on, people in workplaces, being out in retail and recreation, it does seem to be relatively flat since we got into September. Likewise, staying at home, if anything, is slightly increasing as opposed to actually going down. And so I think people's behavior hasn't necessarily changed, which is, I think, certainly a bit of a good message here. Looking at Niagara, I think we'll see quite the same pattern. People staying home is pretty flat. If anything, people are maybe staying home a little bit more, likely due to weather being cooler, so you're staying indoors more. And likewise, people being out and about shopping and enjoying recreation. It's come down since the summer and early fall. It's still higher than it's been at any point in the pandemic, but it's staying pretty flat. And so I don't think the case increase can really be attributed to a change in that. People, I think their behavior is staying the same. But of course, given that if they are out and about shopping, they're going to restaurants, they're going to gyms and the like, a lot of those places no longer have the capacity limits they previously had. And so those places have become higher risk. And that might be more of a reason why we're seeing some of the increase that we're seeing. Of course, we do know that this is a pandemic of unvaccinated people. This is Ontario data showing what the case curve has been amongst unvaccinated people versus fully vaccinated people. And you can see how much higher the risk is of an unvaccinated person to a fully vaccinated person. And that difference becomes even more stark when you're looking at hospitalizations or ICU admissions. And so probably any increase in cases is really being driven again by unvaccinated people. And I think when we take a look at our age trend, this becomes really apparent. So this is how ages of cases have really trended throughout the pandemic. And if you look here at the orange line here, I'm not sure why that has turned red near the end there, but this orange line is going up sharply. And that's, of course, our under 12 group. And that's the group that's not yet eligible to be vaccinated. And so therefore, I don't think it's a huge surprise that that group is going up. Just to zoom in a little bit on that group for the most recent period, you can see that even more starkly here, that under age 12 group who can't be vaccinated is where our case growth is really being driven. There is some case growth here in the 30 to 60-year-olds, and I wonder if perhaps some of these may be the family members and parents of some of these children, which is why we're seeing that go up. And when you look at the oldest age groups, the groups with the highest vaccine uptake, you can see they remain the lowest in terms of their case uptake. And so I think this is really a story that without the preventive measures we've had in society and with people moving indoors more, we've increased the risk of COVID-19, and that risk is going to be most acute in people who are less vaccinated. And of course, the group that has the least vaccination is a group that's not yet had the opportunity to be vaccinated, the under 12 age group. If we take a look at that breakdown of younger age groups in a little bit more fine detail here, I think it's very interesting that this really highlights that school age group 6 to 11, that's going to hopefully soon be eligible for vaccination, is the group where we're seeing the sharpest increase. Next sharpest increase is in that kindergarten age group just below them, age 4 to 5. And then we're seeing, the secondary students age 12 to 17, which is, of course, our age group, next lowest age group in terms of vaccine uptake. And then when you get into older age groups, we're not necessarily seeing quite the same increase. And of course, age 12 to 17 children are likely often around the age 6 to 11, which is partly why they have some of that risk. The age 6 to 11 children are often perhaps around age 4 to 5 children, which allows that risk. So there's a lot of probably interaction and spread amongst these different populations. And they're, of course, unvaccinated or relatively lower vaccine uptake. And I think we're seeing very much how vaccines control the pandemic in groups that have been vaccinated, but can't control the pandemic in the groups who have not yet been vaccinated. And I think one of the ways we're going to get this under control is to hopefully get approval to vaccinate the 5 to 11 age group and actually get a big chunk of these groups vaccinated. So therefore their risk will come back down. This pattern of seeing this younger age group, seeing cases go up, I think is not unique to Niagara. We're seeing that here when we look nationally at the data. The 0 to 11 age group, so again, the under 12 age group, was the highest incidence group during the fourth wave. In Niagara, we seem to not see that group rise up in terms of their case spread until more recently. But nonetheless, I think that is a consistent pattern, and it makes complete sense. If the infection is going to spread amongst the unvaccinated, the group who can't be vaccinated is going to be the least vaccinated and therefore going to see the most cases of infection. And we've seen this also in other countries. This is the United Kingdom, where you can see that 7 to 11 age group is really the age group where cases have been going up, not so much happening in other age groups. If we take a look at where spread is occurring in a different way, looking at what are the different settings where you've had outbreaks over the last 5 weeks or so here. Some of these are pretty similar to what we've talked about in the past. We have, workplaces here, healthcare facilities here in the blue. The green are workplaces. We have food services, which have often been workplace outbreaks. Those, I think, are quite similar. We've seen an increase, though, here of outbreaks in the education sector, which of course fits that's where you're seeing that 4 to 11 age group, where you have the greatest growth in cases. So it's not surprising that sadly, some of those cases are then spreading infection within their education setting. But I think what's also really interesting here is how athletics and sports has really picked up as an area where we're seeing more outbreaks. This used to be a very small piece of the pie, even just 2 or 3 weeks ago. And of course, the province lifted capacity limits in these settings. So I think that is likely part of the driver of why we're suddenly seeing outbreaks here, because the preventive measures that used to be in place to prevent outbreaks have been lifted and we're seeing more. And we're particularly seeing some outbreaks in youth and athletics, sports and athletics when it comes to youth, where there isn't a vaccine requirement necessarily for them to use these sporting facilities. And so therefore that is also, I think, driving some of these outbreaks. And so I think it really speaks to, again, the importance of both vaccination, but also having those other preventive measures that we've had in the past, such as capacity limits, to make sure we keep infections under control going forward. And I hope that's something that we can now revisit as a province, that we're seeing cases go up, to maybe step back and put some of those measures back in place. We've seen, in other countries, this is from the Ontario Science Table, where if they've lifted their measures in society, they've had more infections. So I showed you the stringency index, which was a measure of how strong lockdown measures are. And so this is Ontario here. Over time, we've, of course, lifted our lockdown measures and restrictions and come down to this level. And you can see Denmark in the gray and Finland in the blue have come down and lifted those measures much more strongly than us. And parallel to that happening, where they made the big deviations from us in early September, you start to see that they deviated in what happened with their cases going up. Even though a place like Denmark was actually ahead of us in vaccination, that wasn't up. That nonetheless, this gray line shows they still had that increase in cases. And I think that emphasizes again that we need both vaccination, but also those other measures to make sure that we are able to keep COVID cases under control going forward. And of course, I think we've talked in the past about Alberta and Saskatchewan, and these are the patterns that Alberta and Saskatchewan saw with deaths and how many more deaths they have seen from COVID-19 compared to us here in Ontario. And that was, again, in early July, they lifted all of their preventive measures. That allowed cases to spike. When cases spiked, the fraction of people who are sadly passing away also spiked, and we've seen a much greater increase. And I did the calculation in the latter part of October that between July 1st and I think around October 21st or so, the difference between what happened in Niagara versus what happened in Alberta and Saskatchewan would have meant that Niagara has prevented about 65 to 80 deaths from COVID-19 by not going down the trajectory that Alberta or Saskatchewan did, by having the trajectory that we had here in Ontario, where we kept COVID under control. Now, as a combination of both, we had higher vaccine uptake than Alberta and Saskatchewan, but also we didn't completely reopen July. We kept some of our preventive measures in place. And I think that speaks to, again, why it's so important we continue to drive a vaccination, but we also keep those preventive measures in place going forward. I think the one bit of good news that we're still seeing here is when we look at hospitalizations and ICU admissions, we've not seen these numbers come up, and they've actually been trending downwards. And I think that's thanks to our ability to keep cases under control the last little while, which does mean we do have a bit of room for error right now. So we are able to have time to react in a tailored, careful way to bring cases back under control before we start a big spike that could be quite crippling to us. And likewise here in Niagara, I think we can see our hospital numbers and ICU numbers, while not zero, are in relative control compared to our past wave. And so we have time to get this back under control, but I think it's important we do take some steps now to get it back under control. And just to emphasize this was the latest briefing by the Ontario Science Table, where it talks about here that we need to continue some public health measures on top of vaccination if we're going to control the pandemic, as other factors such as cold weather increase cases, hospitalizations, and ICU occupancy. Again, really emphasizing that it's a combination of vaccination and ongoing measures to control the pandemic. And likewise, we see here with the Public Health Agency in Canada coming out on Friday, highlighting that we've had vaccines in 84% of the population in Niagara who can be in Canada who can be vaccinated is vaccinated, and that's providing excellent protection. But we also need to layer up other protections as we get into the fall. Continue to wear masks, improving ventilation, avoiding crowding, and measures that I think reduce crowding, require people to wear masks, are therefore going to be important to make sure we keep the pandemic under control as we get through the fall, and make sure we don't see a spike of cases and deaths as we go through the rest of this fall and winter season. Of course, as I talked about with the 4 to 11 age groups being where we're seeing most spread of infections. We're very much looking forward to getting the vaccine so we can start vaccinating that group. And that's going to give us one more tool to make sure we get COVID-19 under control and prevent a pandemic, another pandemic wave from rising. This is what our vaccine uptake looks like. And, I think we've reached a bit of a milestone where we've now got to every eligible age group has got to at least 70% fully vaccinated. And almost every age group now has up to 75% having at least one dose. So we're definitely making progress. It's slow progress, but we're definitely getting those vaccine numbers up. And you can see here, we're almost at 84% of people fully vaccinated, adults almost at 85% fully vaccinated. The vast majority of people are getting vaccinated. And just to highlight again, this 12 to 29 age group is where there's the most room for improvement, but also definitely some improvement in the 30s, 40s, and 50-year-olds here. Going forward, we obviously want to continue to get first and second doses up in these age groups where there's still room to improve. But of course, a big priority is going to also be to vaccinate that 5 to 11 age group as soon as they become eligible. And then on top of that, of course, we now have upcoming booster doses for this 70-plus age group. And you can see the 70-plus age group, pretty much all have got their 2 doses already. There's very few who remain with only 1 dose or no doses. So likely we can expect almost all of them are going to come back to get that booster dose. That's a population I think has really seen the value of vaccination and really bought into it. And when we start to think about how large these groups are, I think, it's important for us to think about what vaccine rollout is going to look like in the next little while. So we have 45,000 people who are currently eligible for vaccination who are not yet vaccinated. So we need to deliver a bunch of second doses and in many cases first doses to this group of the population. So there's a good probably 75,000 doses between the first and second doses in that population that we still need to deliver. We, of course, started to see eligibility for healthcare workers, Indigenous persons, and caregivers to receive their booster doses. And, we don't have a precise measure of how large that group is, but it's about 25 to 45,000 people, we estimate, who will be eligible for booster doses, some of whom we're already seeing and are already getting those booster doses into. We then are going to have children hopefully approved by early December for their vaccinations. And so that's about 32,500 children. And of course, we'll need to do 2 doses of them. So that gets us close to about 65,000 doses that we need to do. And then with age 70 group becoming eligible in December to get their booster doses, that's going to be another 75,000 people eligible for vaccination. And so if you add this up, there's a lot of vaccine doses coming up. Doing quick math here, this is over probably close to 250,000 doses of vaccine that need to be given out. That's about a 30% increase in the number of doses we've already given. And I think something that we need to be mindful of is that we're not going to be able to do all of these vaccinations very quickly. This is going to take several weeks to work through, just like it took several weeks to vaccinate everybody over the course of the spring and summer. And I think we're going to be, again, looking at that kind of rollout. And I think our rollout is going to be slower because, of course, Niagara Health is not involved with vaccination anymore. They have a huge backlog of surgeries and procedures, and that's where they're focusing their attention. But likewise, a lot of the big centers where we did vaccines clinics in the spring and summer are no longer available for vaccination. They're back to doing their normal activities if things have opened up. So we're not going to be able to run as large clinics. As well, a lot of the healthcare providers we had delivering vaccinations are no longer around. Many of them had come out of retirement temporarily to help with the vaccine effort. They've gone back into retirement now. There's many people who are quite burnt out over the course of the pandemic, and they're no longer around. And so both because of the size of our workforce and the size of the centers that we have for running vaccine clinics, we're going to take a while to, I think, get through this group of vaccinations. And so when we're thinking about how we're going to manage this, I think we're going to want to be strategic about where we deliver our vaccines. I've talked a lot about how unvaccinated people are what are driving our pandemic right now, and particularly that the 4 to 11 age group is where we're seeing the highest risk of infections. And so I think what we're going to be doing is we want to prioritize this age 5 to 11 age group first and foremost. That's going to make the biggest impact on the pandemic because that's where there's the greatest risk of infection spreading. Also, just from a fairness point, this group has not had any opportunity to be vaccinated yet. So they deserve to get first chance to get an opportunity to get a first and second dose because everybody else here has already had that opportunity. And so that is going to be our priority. And we're likely, when we get approval for that 5 to 11 age group, we're temporarily going to be vaccinating this group exclusively to make sure we get as many of these children that opportunity to get vaccinated as quickly as possible. I think the next most important priority for us then is the people who are not yet vaccinated at all. Getting first doses, second doses is really what's going to do the next bit of good. Obviously, we're not seeing a huge rush of these people coming for vaccines, but to the extent that we see them coming forward, we're going to want to give them priority access for vaccine opportunities. And then the booster doses. We're not seeing a lot of infections amongst people who are fully vaccinated. Obviously, the vaccine isn't 100%, and this is going to give them a little bit better protection. But these groups have 70, 80, 90% protection already. They're only going to get some marginal benefit from additional vaccines. So they're going to be, unfortunately, the lowest priority if we do see the flood of other groups coming forward for vaccination. And so what I would really recommend right now is if you're one of these healthcare workers, an Indigenous person, a caregiver, someone in that 70+ age group, I'd recommend you go book an appointment for vaccination because if we have walk-ins, we're going to be prioritizing walk-ins to 5 to 11s, people who don't yet have first and second doses because they're the priority to get vaccine doses. However, if you've booked an appointment, you'll have that appointment. You'll know for sure you're not going to be waiting while perhaps a bunch of people coming for their first and second doses get to go first for the vaccine. And of course, nobody wants to be waiting out in the cold weather that's coming up. And so I strongly encourage all of these age groups who are going to be eligible for booster doses to book an appointment so you know you have a guaranteed time when you're going to be able to come and get your vaccine. And I also want to caution people that when children are available to have a vaccination, we're going to basically be reserving almost all of our appointments for that age group to make sure that they get that opportunity to get that first and second dose when they've not yet had that opportunity. And so we can also make sure we vaccinate the group at greatest risk of infections right now. And so that's just some caution. And I think the key message there is make sure to book an appointment if you're looking for that booster dose. And even if you're looking for a first or second dose, or if you're a parent of a child who becomes eligible for a first and second dose, booked appointments, I think, are again going to be really important because we have so many people coming for vaccinations now. I don't think walk-ins are necessarily going to be something that's going to be manageable to make sure every walk-in is able to get into our clinics. And so you want to be booking appointments once again. And with that, I'll stop and turn it back over to Courtney to moderate the questions.
Great, thanks, Dr. Hirji. Okay, so first on our list, we have Paul, and you should be able to unmute now.
Can you hear me okay?
I can hear you well.
Oh, thank you. Oh, Dr. Hirji, with the importance of getting kids vaccinated, being that they're now the main driver of outbreaks, should school boards, in your opinion, require kids to be vaccinated to attend in person, the same way that you'd have to show that you've had your measles, mumps, and rubella type of vaccine? Do you think that's a good idea?
I'm a little bit cautious around that. We do have a substantial number of children not yet vaccinated, as you note. We're only up to 70% fully vaccinated in that 12 to 17 age group. And I think it's going to take many weeks to get the vaccines into that 5 to 11 age group for, first that first dose and then that second dose. As well, what we saw with the 12 to 17 age group is that while we had about 40% of that age group initially sign up, it took a little while longer before we got up to where the 70% where we are now. And I think there's a period going to be where, the vaccine comes out, a first group is going to go out and quickly sign up for it, but another group of parents is going to be a little slower. They're going to want to make sure they learn about the vaccine, feel really confident, safe to give their parents. They're going to want to hear more information. And they may also want to just see how the first groups of people react to that vaccine. And I'd be wary of blocking out really large numbers of children from in-person learning because of that. I think there may come a time where vaccines are required for children to attend school. I don't think that's going to be upcoming in the near future. I would encourage, though, every parent to get vaccinated because if their child is vaccinated, that means that they're not going to be affected by those outbreaks when they do occur in school, especially when there is an outbreak in school. If your child is in a class that's affected, while the unvaccinated students have to isolate at home, a vaccinated student can still continue attending school and they don't get that disruption. And of course, they're not going to be as likely to bring infection back to vulnerable people in the family. So at this point, I wouldn't recommend that we limit school attendance to vaccinated children, but I would definitely strongly encourage it because I think there's huge benefit to that. And maybe down the line, once we've had higher uptake and I think we've maximized vaccine uptake, it could be something that could be revisited, such as with other vaccines that are not necessarily required to attend school, but requirement that you've made a conscious choice and reported that choice for that vaccine.
And a follow-up?
Sure. I just thought I'd ask you if you have an opinion on the province deciding against mandatory hospital staff vaccination mandates. Obviously, the Shaver and Niagara Health have opted to make it mandatory. Hopefully that won't change, but do you think that will affect us really here in Niagara, given the fact that our hospitals have really gone the other way?
Yeah, I'm a bit disappointed the province didn't go down the road of requiring vaccinations for those healthcare institutions. I see this as a patient safety issue. When you're sick, you're vulnerable, you go to the hospital to get care. The last thing we need is for you to be put at risk because there's an unvaccinated staff person there who then spreads infection to you. And so I thought, requiring vaccination was a sensible way to make sure we kept hospitals safe. I'm definitely pleased that Niagara Health and Hotel Dieu Shaver have decided that it's the right move to make sure they protect their patients by making sure everybody gets vaccinated. And of course, also protecting fellow healthcare workers to make sure that they are safe as well.
Great, thank you. Okay, up next we have Ludwig, and you should be able to unmute now.
Thanks, Courtney. Hello, everyone. Hello, Dr. Hirji. I was just wondering, Dr. Hirji, what's going on in Fort Erie? The municipality had pretty low numbers pretty much throughout the pandemic, and now we're seeing like 54 active cases as of this morning, I think, and it seems like it was a pretty considerable surge there. So could you talk a bit about that, please?
Yeah, and I think some of this has been covered as well. There's unfortunately an outbreak amongst young people, certainly centered around the John Brand School, where there's been a bunch of infections. But the way outbreaks work is that an outbreak isn't just in one place. There's children, teachers go out and live their lives out in the community. They're involved in extracurriculars. They're involved with athletics. They're spending time with their family, friends, extended family. And so sadly, I think we've seen a lot of spread of infection through these multiple different settings to many other people as a result. That's really what's going on in Fort Erie right now.
And a follow-up?
Yeah, so you mentioned athletic facilities, etc. So what about commercial gyms? What are you learning from those types of settings, fitness facilities, etc.?
Yeah, I don't want to dive into too deep into any kind of subset. What we're definitely seeing is people participating in athletics, recreational type activities. We are definitely seeing some spread of infection amongst those groups. Sometimes those could be in gyms, sometimes they could be in other kinds of centers. That's, I think, a direct function of the close interaction people have while participating in those physical activities. But actually, even more importantly, perhaps, is the interaction they have inside a change room. And with the province lifting capacity limits in these facilities, now you can have a much more densely packed change room where lots of people are perhaps in the change room after they participate in athletic activities. And that creates a perfect environment, unfortunately, for infection to spread. And so we're quite concerned that that lifting of capacity limits is perhaps a big driver of what is leading to some of the spread we're seeing.
Thanks. Okay, up next we have Gord, and you should be able to unmute now.
Hi, thanks. I just wonder with school cases and a few outbreaks haven't been in the news lately over the past week or so, if that's resulted in any sort of noticeable increase in parents getting kids in the 12 to 17 group vaccinated.
Yeah, we haven't really seen much of an uptick in that 12 to 17 age group over the last few days. It seems pretty much constant what we're seeing. Every day, more parents are making the decision to get their child vaccinated, which is certainly good news, but I don't think it's really increased much over the last few days.
And a follow-up?
And Also, you'd mentioned 83 to 84% as the percentage where we could probably avoid further restrictions. But at the region meeting last week, you referred to hospital capacities being up around 100% level. Does the hospital capacity affect your thoughts on the 83 to 84% range, as in might that lead to more restrictions?
Yeah, so to clarify, the 83, 84% was based on national level modeling of what would cause major restrictions, such as a lockdown. Not necessarily that we would have some smaller scale restrictions in society. So I think we are at a point where lockdowns are going to become pretty much unlikely. Our healthcare systems are going to be able to manage without a lockdown, but that might be the experience we're seeing in places like Alberta, where they are having to airlift their patients to Ontario hospitals to manage the capacity. So at a national level, we'll be able to manage the capacity, but any kind of individual region might still be overwhelmed. And we'll be able to avoid a lockdown, but not necessarily the severe illness, the hospitalizations, some of the deaths that could occur. And I think ideally we'd want to try and control all of that going forward. Sorry, what was the second part of your question again?
The hospital capacities and whether that might affect it.
Yeah, so what I think we're seeing with the hospital capacity right now is it's over 100%, but that's, I think, because Niagara Health is trying to catch up on all the people who've missed out their hospital care over past months, people who had their surgeries, had procedures deferred because they were dealing with a surge of COVID patients. So there likely is opportunity that you could slow some of that down to have the capacity to deal with COVID-19 infections again. But, I don't think that's really what we would like to see. I think we would like to make sure we get healthcare back to those people by keeping our hospitalization numbers low. And I think we've shown through the fall that we can keep COVID-19 cases under control with some, modest restrictions in society, which still let us actually enjoy pretty much every amenity there is in society. We just need to keep, distance, have capacity limits, wear masks, have vaccine certification requirements, continue to be diligent about hand hygiene, those sorts of things. And I think if we can keep those measures up and not step back on them while continuing to work on vaccination, I'm quite optimistic that we'll be able to avoid any kind of impact on our hospitals, any kind of big increase in deaths. But I think what we can't do is rush to lift the vaccine certification requirements. And I think we may need to come back and bring back some of those capacity limits and other measures to make sure that we're able to keep cases under control through this fall, winter, and spring.
Great, thank you. Up next, we have Emily, and you should be able to unmute now.
We're not getting...
No, not hearing anything from Emily, so we'll move on and circle back. Up next then is Penny, and you should be able to unmute now.
Thank you. Dr. Hirji, I know you've said this a few times today, but I just want to be absolutely clear. Are you suggesting that your advice would be for the province to have capacity limits back in place now? Or are you just saying that it's something that has to be watched very carefully and you might expect to see that in the future?
I'd say it's more the former, maybe not right away, but I think we need to start seriously thinking about bringing those back unless we see cases really start to flatten out and come back down in the next few days. I think, we lifted those measures about 2 to 3 weeks ago, and perfectly timed with that, we're seeing the cases increase now, which is generally the lag we see when you make a change. It's about a 2 to 3 week lag before we see the increase in cases. And I think it's pretty clear that's likely had some impact. And I think particularly when it comes to the athletic facilities, we are definitely seeing spread there where we were not seeing prior to those capacity limits being lifted. And so I think in that setting particularly, I would strongly recommend we move pretty soon to maybe reestablish those limits. And I think we should think seriously about reestablishing them in other places as well. Definitely we don't want to see cases continue to go up and start to be dealing with, more challenging situations within our hospitals again.
Okay, I just wanted to be sure I understood you correctly on that. The one other question that I have is you've talked a lot about the importance of getting children vaccinated as soon as it's approved. I'm sure you're working on where that will happen. Can you give us some idea? For instance, are you looking at going into schools, or how are you going to approach that?
Yeah, so unfortunately, we won't be going into schools, at least not initially, just given the size of footprint available to us in a school. In normal years, we would actually go out and deliver vaccines for hepatitis B, HPV, meningococcal to the grade 7 students in school. And it would take us, a good 2.5 months or so to deliver just one of those vaccines to all of just the grade 7 students. And that's just because the amount of space you have in a school to go deliver vaccines is limited, and that's going to limit your throughput of how many people you can get vaccinated. And of course, the space requirements are even larger now, given that we have to have physical distancing with COVID-19 going, and we don't want to have vaccine clinics to be an unsafe place. And of course, schools are trying to maximize their spacing out of students. So a lot of the spaces we might have used in the past for a vaccine clinic, like a gym, like a library, have actually been turned into learning spaces to make sure they space students out and keep children as safe as possible. So schools are really not an option to vaccinate this group very quickly. What we're going to need to do is be running these vaccine clinics in community centers, very similar to what we did in the spring and summer. It's just unfortunately going to be some of the smaller community centers, given that we're not going to have access to really big centers. The 2,000, 2,500 people we could get through somewhere like the McBain Center or the Meridian Center in Fonthill. Those centers, those spaces are now once again being used up. So we're going to have to run in smaller centers, and that's going to, of course, slow down our ability to deliver the vaccines, but that's going to be the way we deliver to make sure we can get through as many as possible. Once we get through the initial surge of people coming for vaccination, it's possible we might do some small-scale clinics in schools, particularly schools where we see there's been lower uptake of vaccines, to see if that helps. But that's going to be a secondary strategy to try and address in the pockets where there was an uptake, as opposed to our primary tactic of getting vaccines into as many people as possible.
Thank you.
Okay, we'll try Emily again. You should be able to unmute. Not sure if it's just a technical difficulty on Emily's end, but we can always circle back through email. So I'll open it up now. If anybody has a second question, if you want to put that into the chat, we can go through the list that way. Okay, Gord, you should be able to unmute.
Just a small point to clarify. When you talk about transmission in athletic settings, are you talking about on the ice and in the court and in the dressing rooms, or more question of the audience that's watching?
Overwhelmingly, the spread has been in actual participants in the athletic activity. When you can't really know exactly where that spread. Would it spread, while participating in athletic activity? Was it on the sidelines in a sport where maybe some people are on the sidelines while some people are on the playing surface? Did it happen in the change room? I don't think we can definitively know that. But one thing we know for sure has changed lately was the capacity limits being lifted and allowing much deeper crowding inside a change room. And so we're quite suspicious that change rooms may be a big contributor to that. And putting back capacity limits that limits that and keeps the numbers low in a change room and spread out is perhaps what could actually get us back to where we were a month ago, where we're seeing very little spread in these settings.
Great, thanks. I'm not seeing any further questions in the chat. I think we'll end things there. As always, if you have any further questions this afternoon or this week, feel free to reach out to Lisa, Alex, and I, and we can help you out. And thank you for coming.